Hello everyone, my name is Nadia Jones and I am a nursing student at Indiana State University's LPN-BSN program. This health education program is for Nursing 444 Community Health. Youth vaping, a creative solution to a serious public health problem. Before we get started, please take a moment to pause this video and access the pre-test link featured in the video description below. Learning objectives. By the end of this presentation, all participants will be able to define vaping, explain why vaping is not a safe practice, report the population at risk for vaping, explain how vaping is targeted at children, identify the health risks associated with vaping, and explain creative strategies to prevent and help adolescents stop vaping. After program completion, all participants should be able to pass the post-test. What is vaping? Vaping is defined as the utilization of electronic tobacco devices, either used as an addition or alternative to regular cigarettes. Electronic cigarettes may be called vapes, e-hookahs, e-cigs, vape pens, mods, pod mods, Juul, dab pens, dab rings, tanks, or electronic nicotine delivery systems. Electronic cigarettes come in many different forms. They can look like cigarettes, pens, pipes, cigars, USB drives, and household items. Electronic cigarettes were first conceptualized in 1965 and then first marketed in 2003 in China and 2007 in the US. Some of these high-tech devices are reusable, while others are disposable. Adding flavor to the electronic cigarettes has normalized smoking, especially for teenagers. Popular flavor choices include strawberry, blueberry ice, Cool Mint, and Skittles mixed with Red Bull. Devices used for vaping are also commonly personalized, which increases popularity of vaping among younger users. Electronic cigarettes work by heating nicotine to create an aerosol that is then inhaled by the user. As users exhale the aerosol, other people nearby are exposed to the electronic cigarette's ingredients, just like secondhand smoke from regular cigarettes. As mentioned earlier, vape pens come in many different forms, but the components are basically the same. There is the cartridge, which holds the substance or electronic liquid. It may be pre-filled or refillable. There's the atomizer, which is a coil which is used as a heating element to convert the electronic liquid into an aerosol. There are the sensors, which may or may not have a power button associated with it, but either way, the sensor is used to turn on the device. And then there's a battery, which is a rechargeable lithium-ion battery, which provides enough current to heat that atomizer in order to create the aerosol. Although electronic cigarettes contain fewer toxins than regular cigarettes, they are still not safe for human consumption. According to the CDC, the ingredient list for different aerosols varies, but may include nicotine, diacetyl, nickel, tin, lead, ultrafine particles, volatile organic compounds, and other cancer-causing chemicals. Propylene glycol is an ingredient and a known carcinogen, which can cause dry mouth and upper respiratory infections. A major ethical concern regarding vaping is that some products are falsely labeled as nicotine-free. This misinformation impacts the patient's perception of the product and ability to make informed decisions. According to a study in 2018 by the Truth Initiative, 68% of adolescent users did not know that all vaping products contain nicotine. Although data is inconsistent, some studies show that the aerosol in electronic cigarettes negatively affects resting heart rate, blood pressure, and the lining in blood vessels. Another concern is that carbonyl compounds such as formaldehyde from the aerosol may be linked to atherosclerosis and blood clots. Currently, electronic cigarettes are not approved for cigarette cessation by the FDA. Current evidence-based practices for effective smoking cessation include nicotine replacement therapy, counseling, and medications. Who is at risk for vaping? Vaping is legal for adults as long as illegal substances are not used. Vaping product advertisements often target smokers who are looking to quit. According to the CDC, vaping is most common among adolescents. In 2008, the U.S. Surgeon General deemed youth vaping as an epidemic based on significant spikes in youth e-cigarette usage. A CDC study in 2018 found that 4.9% of American middle schoolers and 20.8% of American high schoolers reported vaping. By 2019, 10.5% of middle schoolers and 27.5% of high schoolers reported using e-cigarettes. By 2020, rates improved to 4.4% of middle schoolers and 19.6% of high schoolers, but still raise a public health concern about adolescent vaping. The 2020 National Institute on Drug Abuses Monitoring the Future study found that the percentage of 8th, 10th, and 12th graders who vaped remained constant throughout 2019 and 2020. Why are children drawn to vaping? Electronic cigarettes are sometimes marketed over social media sites such as Twitter, Instagram, and YouTube. The CDC 2019 National Youth Tobacco Survey found that between 54 to 59% of middle and high school students reporting using Juul as their usual brand. According to the Truth Initiative, more than 3 million children vape regularly. Some companies hire social media influencers under 30 to promote the product. In a 2016 survey, findings indicated that young adults associate vaping with escape, rebellion, and experimentation of self-identity. According to a survey in 2019, middle and high school students report being exposed to e-cigarettes at retail stores and gas stations, on television, and in magazines. According to the Population Assessment for Tobacco and Health, adolescent and young adults primarily choose to vape because they like the flavoring. Middle and high schoolers typically favor fruit, mint, menthol, and candy flavoring. Some e-liquids are named after common food items, such as Thin Mint Girl Scout cookies, Tootsie Roll, Weddy Rip, Nella Wafer, and Warhead candy. What risks are associated with vaping? Like regular cigarettes, vape pens contain nicotine, which is highly addictive and dangerous for pregnant women, developing fetuses, and adolescents through their mid-20s. Nicotine is known for harming brain development. Vaping increases the likelihood of smoking regular cigarettes, especially in children. And recent data indicates that 22% of people who vape become new cigarette users. The toxins in e-cigarette aerosols can cause respiratory injury and lung cancer as well. If the e-cigarette liquid is ingested, either by swallowing, breathing, or absorption, toxic acute nicotine exposure can occur. This is especially dangerous for children. Scientists have found that vaping is associated with increased risk for chronic cough, bronchitis, and asthma. Vaping use-associated lung injury has caused 68 deaths and 2,807 hospitalizations as of February 2020. Symptoms may include cough, labored breathing, reduced oxygenation, elevated white blood cells, shortness of breath, chest pain, nausea, vomiting, stomach ache, diarrhea, fevers, chills, and weight loss. Adolescent users often experience severe dependency symptoms as well. And this might show as loss of concentration and midnight cravings. Electronic vaping devices can be defective, which can cause potential harm if a fire or explosion occurs. So what creative strategies can be implemented to prevent and help adolescents stop vaping? There are a few federal restrictions on electronic cigarette marketing. The FDA acted against the sale of candy and fruit-flavored refillable e-cigarettes in January of 2020. Several months later, the FDA asked retailers and manufacturers to remove disposable flavored e-cigarettes as well. As of December 2020, only 7 states have restricted the sale of flavored e-cigarettes. One strategy was created by the Truth Initiative, which has a free and anonymous text message program for adolescents and young adults geared towards helping young people quit vaping. This program is called This Is Quitting. The program began in 2019, and evaluation data has shown that 60.8% reported successfully quitting electronic cigarettes after just 2 weeks. Teens can text Ditch Vape to 88709 to get immediate help. Another strategy is to involve parents. Parents can be educated about the risk of e-cigarettes and then serve as tobacco-free role models for their children. A final strategy should be to include vaping in medical professionals' tobacco screening tools to either serve as a prevention or treatment tool for teen vaping. If you're interested in more information on the topic of teen vaping, please check out the references listed below. Thank you for your time. Now please take a moment to pause the video once again to access the post link and brochure in the description below.